This module on catheter care is brought to you by Educare, and I'm Jean Howell, and I will be your facilitator. The learning objectives will be to understand principles of different types of urinary catheters, to state symptoms of a urinary tract infection, which we commonly refer to as a UTI, list tips to prevent UTI, and finally to be able to demonstrate steps in providing good catheter care. Millions of Americans have bladder dysfunction every year. About 25% of these individuals are older adults in acute care hospitals. About 7% are clients in long-term care facilities. Due to the dysfunction, they require urinary drainage systems to drain and collect their urine. It's estimated that the median time of a UDS in home care is 3 to 4 years. A catheter is a tube which is passed through the body for evacuating or injecting fluids into body cavities, and there are several methods available to accomplish this. There are several different types of catheters, but their purpose is all the same, and that is to drain urine from the bladder. One type of catheter is called a suprapubic, supra meaning above, and pubic is the bone in the groin. This type of catheter is generally used when unable to insert a catheter through the urethra due to some obstruction, or there is a need to allow the urethra and the bladder sphincter to heal. An incision is made through the skin in the abdomen about 2.5 centimeters above the pubic bone into the distended bladder. And this is generally done under general anesthesia. And if it's to remain in place, the catheter can be sutured to the abdominal skin. A sterile dressing is applied around the insertion site, and usually every morning and as needed, it can be changed. And a closed system must be maintained at all times, as contaminants could pass through the tubing into the bladder, the same as with the Foley catheter. Another type of catheter is what we call the indwelling catheter, and this allows the catheter to remain in place in the bladder. It is inserted through the urethra, and after it is in place in the bladder, sterile water is injected through a balloon port in the catheter, which fills a balloon attached to the catheter inside the bladder. Once this balloon is filled with water, it becomes anchored in place in the bladder so the tubing can't slip out. And whenever the catheter is changed, the balloon must be deflated before the catheter is removed. Indwelling catheters are invasive devices with significant complications. Infection, incrustation, irritation, and inflammation of the bladder are common. Long-term use of catheters provides access for bacteria from a contaminated environment, and as a result, catheter-associated urinary tract infections occur. 80% of these infections are the result of E. coli, which is a bacterium that can cause serious infections once inside the urinary tract. Clinical nursing skills says that almost all clients will be bacteriuric after 1 month of catheterization. And the chronic irritation and inflammation of the bladder mucosa due to long-term use or presence, and they define long-term as more than 8 months, this presence of an indwelling catheter is associated with an increased risk for bladder cancer. Here are some of the complications with long-term placement with an indwelling or Foley catheter. Catheters certainly can leak. They can cause bladder spasms, and it causes the tubing to move or to come out. Urethritis, prostatitis, scrotal abscesses, prostatic abscesses, can cause urinary stones, urethral sphincter damage, and as we mentioned in the previous slide, it can contribute to bladder cancer. The number one goal of good catheter care is preventing infection. Maintaining a sterile, continuously closed and sealed urinary drainage system is critical to prevent infection. These now would be some signs and symptoms if there was a urinary tract infection. A fever of more than 100 degrees Fahrenheit, cloudy or bloody urine, and a foul odor to the urine. There may be discharge around the catheter, and a client reporting any pain in the bladder area. Any of these symptoms must be taken seriously and reported to your nurse. Thorough hand-washing hygiene and wearing gloves during cares is an excellent way to help prevent infection. And then another is to offer the person at least 3 8-ounce glasses of fluid a day. Cranberry juice is especially good, and there is growing evidence-based information in support of the use of cranberry juice in UTI prevention. Its beneficial effect is not by acidifying urine, as I had learned in nursing school, but by inhibiting adherence of E. coli and other pathogens to urinary tract cells. A recent trial demonstrated that 1 tablet of concentrated cranberry extract, that would be 300 to 400 milligrams, given twice daily, or 8 ounces of pure unsweetened cranberry juice 3 times daily, is safe and effective for up to 12 months. Cranberry may increase urine oxalate or salt levels, and so may increase the kidney stone formation in people with a history of kidney stones. Other tips include emptying of the bag. If using a leg bag, empty every 3 to 4 hours, and if using a night bag, at least empty it every 8 hours. You want to provide excellent peri and rectal area care. Wash and dry the rectal area when providing catheter care and after bowel movements. With females, always wash and dry from front to back. And then once a day, wash the drainage tubing and bag with warm soapy water. Rinse it well. For catheter care, you provide privacy to your resident, and then explain to him what you're going to do. You need to wash your hands and apply gloves. Then wash the skin around the catheter insertion site with warm soapy water, wiping from the insertion site to 4 inches down the catheter. For females, you want to cleanse the urinary meatus, which is the passage or the opening, using a circular motion, moving outward with the washcloth, the soap, and the water. For uncircumcised males, retract the foreskin away from the catheter with a mitten-type washcloth, soap, and water. Again, cleanse the area around this urinary meatus. For circumcised males, cleanse the tip of the penis with a mitten-type washcloth, soap, and warm water, and be sure to rinse well and to pat it dry. Remember to keep the urine bag below the level of the bladder, and do not pull on the tubing. You may secure the catheter to the upper thigh with tape or strap, and that prevents the weight of the bag perhaps pulling on the tubing. Next, empty the drainage bag when full or nearly full. Place a large container or a graduate on the floor, or you may simply empty the bag into the toilet. Then, without touching the tip, remove the drain spout from sleeve at the bottom of the urine bag and open the slide valve on the spout. Let the urine flow out of the bag into the container of the toilet, but do not let the drainage tube touch anything. When the bag is empty, clean the end of the drain spout with an alcohol swab. Then close the slide valve and put the drain spout into its sleeve at the bottom of the urine bag. If you're asked to record the output, do that as directed on the care plan. Clean the drainage bag daily with equal parts of vinegar and water. You want to leave the solution in the bag for about 20 minutes and then empty and rinse the bag with clean water and hang the bag upside down to dry. When you're going to switch from using a large bag and go to a leg bag, clamp the catheter near the bag, then detach the current bag and wipe that end of the catheter with an alcohol swab, as well as the connection on the drainage bag. Attach the catheter to the drainage bag once both ends have been properly cleaned with an alcohol swab. Finish up by removing your gloves and washing your hands, and if you have noticed any thick, cloudy, or bloody urine, be sure that you report that to the nurse. This video will show you the steps in demonstrating Foley catheter care. And we have a nurse as our model today rather than a real-life resident, but the steps and the procedure is the same. So of course you provide privacy and tell the resident what you're going to do. Wash your hands and put on your gloves. Number 1 is to wash the skin around the catheter insertion site with warm soapy water, and you wipe from the insertion site to about 4 inches down the catheter. The care for males and females obviously is a little bit different. For the females, you want to cleanse the urinary meatus, which is the passage or the opening, using a circular motion, and you move outward with your washcloth, soap, and water. For uncircumcised males, you'll need to retract the foreskin away from the catheter and cleanse with a mitten-type washcloth and soap and water around the urinary opening. For circumcised males, you need to cleanse the tip of the penis with a mitten-type washcloth, soap, and water, and be sure to always rinse well and pat dry. It's important to keep the urine bag below the level of the bladder, and that's to allow the urine to flow by gravity from the bladder into the bag. Do not pull on the tubing. You want to secure the catheter to the upper thigh with tape or a strap. Empty your drainage bag when it is full or nearly full. You can place a large container or a graduate on the floor, or you may simply empty the bag into the toilet. Now, without touching the tip, you remove the drain spout from the sleeve at the bottom of the urine bag. And you allow the urine to flow into the container. Now we'll say that the urine bag is empty. You close the drain. I have an alcohol wipe. I want to cleanse that tip well inside before I insert it back into its sleeve. Record the urine output if it's required on the care plan. In addition to a suprapubic catheter or an indwelling Foley catheter, there are condom catheters. This is an external system recommended for incontinent men without urine retention. These devices are comfortable, and there is a less chance of a urinary tract infection than with indwelling catheters. This type of catheter can be used either attached to a large collection bag or to the smaller leg bag. I'm going to go through the steps in providing condom catheter care because there won't be a video on this. Your first step is to gather your supplies. This will be a bath towel, soap, warm water, washcloth, hand towel, the catheter, and the bag. And obviously provide privacy and explain to the client what you're going to be doing. Wash your hands and put on your gloves. Then place the towel underneath the client. You need to wash the penis with soap and water and then dry it thoroughly. It may be necessary to clip the pubic hair or shave the area near the base of the penis. You hold the penis at a 90-degree angle from the body and gently roll the condom over the penis, leaving 1 to 2 inches of the condom catheter at the end of the penis. I want to caution you that the adhesive that comes on the condoms is very sticky, and it's very easy to get your gloves stuck in this stickiness. The condom can be kept on for 3-4 days, and once it's removed, though, it's disposable and not used again. Connect the condom catheter to the drainage bag. And if using a smaller drainage bag attached to the leg, make sure to use the catheter leg strap to secure the bag as you would for a person who had a Foley catheter. And you empty this drainage bag the same as you would with a Foley. Clean the drainage bag also as you would with someone having a Foley catheter. This is a video demonstration on how to apply a condom catheter, and we were not able to get a live model, and so our nurse has improvised some of the equipment for this demonstration. As always, you want to provide privacy for your client and tell them what you're going to do. Wash your hands and apply the gloves. You wash the penis with soap and water and then dry thoroughly. It may be necessary to clip the pubic hair or shave the area near the base of the penis. The procedure is to hold the penis at a 90-degree angle from the body, and then you gently roll the condom over the penis leaving 1 to 2 inches of the condom catheter at the end of the penis. As you can see, the underside of that condom catheter sheath is very sticky and it's easy to get your gloves caught under there. Next, you want to connect the condom catheter to the drainage bag. And again, we're wiping the end of the drainage tubing before we attach it to the end of the condom catheter. And just insert it securely. If you are using a smaller drainage bag attached to the leg, make sure that you use the catheter leg strap to secure the bag as you would with a Foley catheter. Emptying the bag is the same as you would with a Foley, and you also would clean the drainage bag as you would with a Foley. That's with a 50-50 solution of vinegar and water. Document what you have done. Just as a note, this catheter can stay on for several days. Once a person has showered, obviously it's disposable. They are not reused. It's considered best practices for a resident to have at least 2 leg bags and 2 large night bags to use. This video demonstration will show how we switch from a night bag or a large drainage bag to a daytime leg bag. So first, we want to put on our gloves, provide the privacy that the client needs, and explain what you're going to do. You'll want to pinch the catheter with your fingers, kind of make a kink in the catheter so no urine drags out or drops out, and untwist the tubing from the drainage bag from the catheter, and then wipe the end of the catheter port with an alcohol swab. The protocol for cleaning that night bag is to insert equal parts of vinegar and water into that large drainage bag and let it sit in there for about 30 minutes, and then rinse it and let it dry. Now, to attach the catheter to the leg bag, again, we're going to clean the port with an alcohol swab and connect the drainage tube to the catheter. When it's time to empty the leg bag, it's just like the large drainage bag. There's kind of a roller clamp here, so we open that, allow the drainage to go into a graduate or a container, and I have an alcohol swab, and I will wipe the end of that again. If you notice any cloudiness in the urine, or any blood or any particles, you need to report that to your nurse. And then when you're all finished, document what you have done. Thank you for your time and attention today in learning about catheter care. When you're ready, you may take the assessment. The skills demonstration will be scheduled with your nurse. And I'm wishing you all the best in caring for your clients or residents who need catheter care.